I'm Naveed Purgasemi, Global Medicine class of 2011, and I'm a current second-year medical student at the USC Keck School of Medicine, and I'm taking action in the real world.
I'm Tracy, and I'm a Global Medicine graduate with a teaching background and an entomology background, and I'm working to improve healthcare access in Africa.
Hi, my name is Andrew, and I'm a Global Medicine student, and I'm taking action in the real world.
So my first experiences in medicine were more on the business side with health insurance, and I was part of the Student Health Advisory Committee, which negotiated a health insurance plan for students. And you know what? I didn't know it going in, but it was going to be, and it was such an impact for these students because it sort of determined their access to healthcare and what they were, able to get. We wanted to keep the costs down, and we wanted to make it a comprehensive plan. So it took hard negotiations, and there was also some questions that had to be answered in there as well, like the idea of adding a stipulation to the insurance plan to cover transgender healthcare came up, and that was a contentious issue because it would raise the plan of the policy a little bit, and our goal was to keep the policy comprehensive and cost effective, but we had to deal with the question like this is a pressing concern for members of our community. Do we address it, or do we just table it? And you know what? We addressed it. We added it to the healthcare plan, and we managed to keep the costs down. So we provided a comprehensive, inclusive plan that made a big difference to everybody. It was affordable, and it encompassed like the care that they need. We had the transgender healthcare, but we also had things like vaccines, lower copays, X-rays. Like we provided access to healthcare for students, and that's something I'm really proud of.
I take action in the real world through my efforts with this organization called AIDS Orphan Education Trust. They're based in Uganda, and a group of Global Medicine alumni and I flew out over a 21-hour trip to Uganda in order to discover methods that would increase healthcare access and healthcare delivery to the people. And some of our accomplishments include renovating the physical appearance of the organization, as well as replenishing the pharmacy, and we actually initiated the first mobile outreach to a remote village within a sugarcane plantation that has never received medical care before.
Well, I take action in the real world through Motivate, my blog. So, inspired by Santa Barbara Street Medicine and their help of underserved communities, I wanted to get involved. I wanted to do something. I wanted to be like them. I thought it was amazing. So I created a blog using my skills. It's called Motivate. It's a mix of humanitarianism and the arts. And it ended up being a collaboration with Santa Barbara Street Medicine where I raised awareness for them. I ended up also creating merchandise, selling shirts to raise money, and also awareness in the community. It's been a way for me to concretely apply everything I'm learning. And it's like, for example, I'm working with Dr. Holtum. Right now, we're actually going to LA County, USC, and it's been near and dear to my heart after I read a book called Half the Sky by Nicholas Kristof to understand the health disparities that are occurring. And I know we're a global program, but to be able to look and focus first, hands-on, up close and personal in a county hospital that's right next door, it's really cool. We're working on addressing health disparities, and I'm actually in the process of writing a survey with him. We're getting IRB proposals, things I've never been able to experience before. And I think it's really cool because Motivate has kind of served as the outlet where I can explain what I'm doing, raise awareness for the plight of these people that aren't getting the proper care.
And in the end, I was like, I'm just going to do it. The global medicine degree is the most exciting of my options. It's the most versatile of my options. And just having read about the curriculum that I read at the time, it was a perfect blend of the sciences, management, politics to a degree, just everything I was interested in, and everything that I wanted to sort of enhance my knowledge of was right there. And so I just told myself, you got to do it. It's now or never. Do it.
I've learned that diseases know no borders. It is necessary to understand a holistic view of medicine, just because problems abroad can quickly become problems at home. And as the world becomes more interconnected every day, we need to take a global perspective on medicine and the treatments and the stigmas affiliated with that.
If I had a message for someone who didn't know anything about global medicine, I would definitely say to make this program come alive, to get involved, and everything, the breadth of knowledge that you learn is tremendous. If you can apply that, you're gonna change a lot of lives. It's something really cool.